Centers for Disease Control and Prevention. We are joining you as usual from the African Union headquarters in Addis Ababa in Ethiopia. My name is Wayne Musabayana and I'm head of communication at the African Union Commission. Today we have with us Dr. John Nkengasong, who is the director of the Africa CDC, who is going to give us his usual briefing that he does every Thursday, including the epidemiological situation in Africa, as well as what is happening with vaccines and other issues around COVID-19. You will recall this is a press briefing strictly to speak about COVID-19 issues and to share information with all our colleagues from the media. So thank you very much for joining us. Dr. John today will also be touching on a very exciting development, which is the launching of the Eastern RCC. Those are the regional coordination centers for the Africa CDC. So there's more coming your way on that. But right now, let me bring in Dr. John for his briefing. Dr. John, good morning, and you have the floor.
Thank you so much, Wayne, and a very good morning from the Africa CDC. And as usual, I will give you the briefings on the current epidemiological situation on the continent, and then discuss what we are doing as Africa CDC to support member states, and then conclude with the distribution or situation of the vaccines on the continent. So let's begin with the epidemiological situation. As of today, September 23rd, amongst the 55 member states, we have reported a total of 8.1 million cases of COVID-19 across the continent. This accounts for 3.6% of all cases reported globally. The total number of deaths as we speak today stands at about 207,000, and the case fatality rate is about 2.5%. And that number of deaths represents about 4.4% of total deaths globally. As we have discussed previously, the continent is still going through a severe third wave. For the three countries, or 78% of our member states are currently going through the third wave. And of these, for the three countries, 32 of them are experiencing a very severe third wave. 7 countries, and I will name them: Algeria, Benin, Egypt, Kenya, Mauritius, Somalia, and Tunisia, are currently experiencing a fourth wave. And of that number, 4 of them are experiencing a very severe fourth wave, which means the peak is significantly higher than during the third wave. And let me just pause here and say that, just to put the severity of this third wave in context, that between the period of June, July, and August, where we saw the peaks of the third wave, 72,000 people died in Africa. If you recall that the cumulative number of people that have died on the continent because of this COVID pandemic is about 207,000. And if during the third wave alone, 72,000 that died, it shows you the brutality and severity of the third wave. During that same period, we recorded about 3 million new cases out of the approximately 8 million. So the third wave has been very severe on us. In terms of the variants, for the 4 countries are now reporting the Alpha variant, 38 are reporting the Beta variant, and 40 are reporting the Delta variant. 3 additional countries reported this variant last week. That include Mali, Burkina Faso, and Sudan. If you now look at it, epidemiological trends, we'll do the trends within the last week and then over the last 4 weeks. Between the period of the 13th and 19th of September, a total of 104,000 new cases were reported across the continent. And this represents a 22% decrease in the number of new cases during that period compared to the previous week. The following 5 countries are reporting the highest daily incident per million population: Seychelles, Botswana, Lesotho, Sao Tome and Principe, and Libya. In terms of new deaths, we recorded a total of 3,300 new deaths during the last week, compared to 3,400 the previous week, and this represents a 5% decrease in the number of new deaths recorded over that time frame. If you now look at the period in the 4 weeks, that is between August 30th and 19th of September, we observed the following trends. In terms of new cases, we noticed a 19% average decrease during that period, the period between August 23rd and September 19th. The following are the trends by region: a 16% average increase in Central Africa, 21% decrease in Southern Africa, 20% decrease in Northern Africa, 17% decrease in Western Africa, and 5% decrease in East Africa. The following is a breakdown by most populous countries, where we tend to just look at our most populated countries. Egypt recorded a 42% average increase in number of death rates. Ethiopia, 14% increase. But South Africa recorded a 26% average decrease. Kenya, 23% average decrease. DRC, 20% average decrease. And Nigeria, 12% average decrease. In terms of testing, to date, a cumulative number of about 70 million tests have been conducted on the continent. Last week alone, a total of 1.2 million new tests were conducted. And this represents a slight decrease in the number of testing if you compare this to the previous week. Unfortunately, the positivity rate continues to be high and stands at about 11%. You heard earlier on that we will be launching on the 1st of October our regional collaborating center in Kenya. If you recall, we have, when the head of states launched the Africa CDC, there were 5 regional collaborating centers, including Egypt, Kenya, Nigeria, Zambia, and Gabon. These centers have been operating, most of them, that is in Gabon, Kenya, and Zambia, and Nigeria, but some of them have not been officially launched. So this occasion will be to launch that in the presence of several ministers from the government of Republic of Kenya. So we will invite you to be part of that ceremony. So let's conclude in terms of vaccines. Where are we with the vaccines? A total of 181 million doses of vaccines have been procured by 53 member states in Africa. Of that number, a total of 136 million have been administered. That is corresponding to a rate of 75% of the total supplies have been used up. If you now look at the number of people that have received 2 doses of the vaccines, what we call full coverage, the percentage stands at 4%. So only 4% of our entire population has now been fully vaccinated. We continue to be encouraged by the progress we are seeing in several countries as they move speedily towards full vaccination. And again, Morocco leads in that chart with about 48% of its eligible population fully vaccinated. South Africa with about 14% fully vaccinated. Egypt, about 5% fully vaccinated. Algeria, about 9.5%. And Tunisia, about 21% fully vaccinated. I'm excited to report that Burundi has now placed an order for the COVAX vaccine through the COVAX mechanism. And this is being supported by the World Bank as well. In terms of the African Acquisition Task Team vaccine delivery. To date, we have delivered 4.4 million doses of the Johnson & Johnson, that is to 26 member states. And new deliveries will start soon. A total of 12,000 doses of vaccines was delivered to the African Union Commission, just to facilitate that staff of the African Union and its ambassadors get vaccinated. These vaccines were procured by the Africa CDC. You also have heard the good news that the government of India will start releasing the vaccines or exporting vaccines come October. And we are very encouraged with that news and welcome it, because it will help us meet our targets for the vaccination of the continent. If you recall, we have set ourselves a target of vaccinating at least 60% of the population by the end of next year. And to conclude, some donations continue to arrive the continent. We have donations from Norway that has donated vaccines to about 400,000 vaccines, AstraZeneca vaccines to Uganda, about 124,000 vaccines to Zambia. And this brings a total of about 726,000 total doses of vaccines that Norway has donated. Germany has already donated more than 8 million doses of the AstraZeneca vaccine through COVAX facilities to member states. And Iceland has delivered about 35,000 doses of AstraZeneca vaccines to Cote d'Ivoire. Thank you, Wayne. So I look forward to our interactions.
Thank you very much, John. And perhaps to kick off our questions, let me start with a quick follow-up on the issue of the launching of that RCC. And before I give you that question, I just want to inform colleagues that we have a notice that came in from our communications officer at that Eastern RCC, Addis Sheba, and she is encouraging every one of us, at least those who can, to register in advance for the launch of that RCC. And she has given the Zoom link right here on our chat platform. So please consult that. So let me give you the follow-up question on that launch. So the Eastern Africa RCC will be officially launched on the 1st of October under the theme Ensuring Effective Preparedness and Response to Current Public Health Threats in the context of COVID-19 and beyond. What level of commitment or assistance does the Africa CDC envision from countries and partners in order to succeed in effectively preparing and responding to public health challenges in that region?
I think we all have recognized during this pandemic that it is no longer a theoretical concept that we must invest in our health systems, because they are automatically the cornerstones for our development, as well as economic growth and, of course, our own health security. So there are a couple of things that we are urging countries to invest in, and Africa CDC is supporting that. First of all, we are saying you have to build your own National Public Health Institute, which it will be the equivalent of having a mini CDC. If you go to the US, United States, they have a CDC. Canada has a public health. The UK has a public health. England and Norway has the same. China has a CDC. The European Union has a CDC. So what we are urging countries to do is to have their own CDC, which will become their own, what I call in quote unquote, the barracks, excuse me, the military barracks, in which you can use in fighting these pandemics, because we now know that these pandemics will be with us for a while. The second thing we are working with countries to strengthen their capacity is the workforce development. We have seen during this pandemic how challenged countries have been in terms of deploying their public health workforce assets. That is the epidemiologists, the laboratory experts, the nurses, and others. So I think that is a second area of that we are urging countries to work in. Let me maybe go back to the National Public Health Institute. There are 4 things that we want the governments to invest in and partners within the National Public Health Institute. One is have your emergency operations center functioning, which is your command center, and then have your surveillance systems and disease intelligence in place so that you can pick up diseases before they become truly a threat. Have good information system that you can gather enough data around, and then of course your workforce. So I think these are some of the key areas, what I call priority areas that we've identified that are challenging countries, and we must invest in that space.
All right, thank you very much, John. We have a follow-up question still on that RCC, and it is this. Throughout this pandemic and even before COVID-19, you have been championing the call for a new public health order for the continent. How does this fit in with the broader vision and mandate of the Africa CDC? And how do you see the RCCs contributing to fit into this vision?
No, absolutely. I think you are right. When I just took the leadership of the Africa CDC, and I did a very simple mapping of how diseases have emerged over the years in Africa, it was very clear that the continent needed to embrace a new public health order to ensure health security, and that the current architecture doesn't necessarily meet our needs, our health security needs. And why is that? If you do a very short trajectory of the emerging of diseases since independence on the continent, you look at starting from 1960 with the emergence of Zika virus in Uganda, and then the chikungunya viruses. Then in 1970, you started looking at the emergence of the monkeypox viruses in DRC. Again, in DRC in 1976, the emergence of Ebola. And then moving forward to 1980s, the emergence of HIV/AIDS. And fast forward to now to the emergence of the COVID-19. And you just realize that we are in for a long haul, and we need to really step back and look at the current health security apparatus. If you now square what I just described with what the events that led to the creation of the system that we are operating in now, that is after the Second World War, the current institutions that we are living with were created after the Second World War. You realize that as a continent, we were about 300 million people at that time. That is from Cape Town to Cairo, from Dakar, Senegal to Mogadishu. Today, we are 1.2 billion people. So it became very clear that as the continent moves forward, and by 2030, we'll be about 2.4 billion people. You need to really step back and look at a new public health order. A new public health order that describes the things that I just asked for, which is have your own continental body like Africa CDC that is strengthened. The Europeans are doing just that. During this crisis, they are strengthening the European CDC and even having more authority and powers to the European CDC and a new system that they will put in place to coordinate health. Second is workforce development. The new public health order, both in the regions, the RCCs and at headquarters, it will tell you that you need more responders there. As we speak, as a continent of 1.2 billion people, we only have about 6,000 epidemiologists. If I only use the epidemiologists as a marker, we only have 1,900, I beg your pardon, and our target is to get to 6,000. So we are a long way from getting to where we are supposed to be. So how do we now put our energy and efforts and move from 1,900 epidemiologists to 6,000 epidemiologists? I think that is some of the key questions that when we started talking about a new public health order, we were very clear. We said a continent of 1.2 billion people cannot rely on externalities for vaccine security. We import 99% of our vaccines and manufacture only 1%. And now we see the effect we are having. Diagnostics is the same. If COVID would have hit us in January, there was absolutely no country in Africa that had diagnostics for COVID. We started training countries using the facilities in Senegal and South Africa in February. So I think that is the whole concept of a new public health order. That is really that we need to step back and take our own, the future of our health security into our hands.
Indeed. Thank you very much for that. Now we move on to our questions. And the very first person to post their question is William Klaus. And William is with Bloomberg. So he says, what is the Africa CDC's position on the position of the United Kingdom not to recognize fully vaccinated people unless they received their doses in select countries? And he adds, even if those jabs themselves are also used in the United Kingdom.
We will be issuing a statement today that will state our official position, which is clearly that that we completely don't understand why why the UK has taken this position. The UK has been an instrumental partner in supplying vaccines to the continent, and which we appreciate. So if in the same token, you send us vaccines and we use those vaccines and you say you don't recognize people that have been immunized with those vaccines, it sends a very challenging message for us, and a message that creates confusion within our own population, and a message that doesn't really speaks to solidarity and cooperation that we all believe are the cornerstones and ingredients for us to emerge out of this pandemic together. The word pandemic clearly means all people, and we are in this together. And the current trends have indicated clearly that we are not just at the level of speculating whether we should come out of this together or not. We have seen that even in countries that are fully vaccinated, the variants come in and challenge that. So it means that we need to really try to be more cooperative and express more solidarity than sending confusing messages that will lead to eventually harming the efforts of what we are doing in Africa. So we'll issue a statement today, and the statement will be clearly along these lines of we regret that the UK will take this position, and we really will calling on them to review this because it doesn't speak to the spirit of true solidarity and cooperation.
Indeed, I think confusing messaging is the best way to put it. All right, let's move on to colleagues who are joining us online, and we have quite a number today, actually. So I'm going to be asking colleagues, please, to ask the one priority question that you have so that we can give a chance to the others to fit into the time that we have. So the first one that we have is Sophie Mokoena from the SABC. Good morning, Sophie, and please go ahead.
Good morning. Dr. Nkenkesong, there were reports this week that you are likely to join PEPFAR. You'll be leaving the CDC. How far true are these allegations? And if you are leaving, will this not affect the work of the CDC at this critical moment? And the last question is on the countries that are not buying or procurement of vaccine are not happening, particularly all vaccines that have been approved by the World Health Organization. Dr. Tedros raised a serious concern. Can you characterize those leaders and countries as committing genocide because they have options?
So no, thank you, Sophie. I think with the first question about my position, I'm sure you are referring to the New York Times report, which, as you know, is a media report. I would ask that with your permission, that I don't comment on that report, because any nomination by any president is the prerogative of that president, and we have not seen an official announcement from President Biden other than a media report. So anything else would be speculative. On the second part, I totally agree with Dr. Tedros that the vaccines that have been or given the emergency use authorization should be recognized across the board, because it doesn't really make sense that we have invested authority in the WHO, and then we do not respect what the WHO is issuing as recommendations. I think that the spirit of that multilateralism must prevail if we need to come out of this pandemic or collectively.
Thank you very much. We stay online and we say good morning or good afternoon to Daniel Arapmoi. Daniel, please just remind us of your news organization and then ask your question.
Well, my name is Daniel Arapmoi from China Global Television Network, based in Nairobi, Kenya. My question to Dr. Kinga. Doctor, countries like South Africa and Kenya have done really well, quite well in terms of vaccinating their people and generally dealing with the coronavirus pandemic. But we increasingly still see countries in the West, having these countries under their travel red list. What is the rationale behind this? And don't you think that this could cause a diplomatic row between the Western world and Africa in general? Thank you.
I think, Daniel, you are really, you nailed it on the head. That is what we have been all asking for, that we should move away from this confusing messaging and decisions that are really not backed by science, and actually base any decisions using good information or evidence. I think there's absolutely no reason why countries are vaccinating, like you mentioned, Kenya, South Africa, Morocco, and you turn around and you put them on a list that begins to create stigmatization. I think that is just clearly not acceptable. I think we should be all raising our voices and condemning such behaviors. That is not what we need for this pandemic.
Thank you, Doctor.
All right, thank you very much. Let's take our last person from the online questions for this segment before we move on to the WhatsApp platform. And let me say good morning to Paul Adepoju. Paul, please go ahead with your question.
Yeah, thank you very much, Dr. John. And so regarding, I would like to know what you consider to be the major message around how health leaders like you and the current director of Nigeria's Center for Disease Control, the message that such leaders like you have really shown the world in providing leadership around the COVID-19 pandemic and its implications for what Africa's manpower roles can be in global health. And regarding the issue of European countries not recognizing some vaccinations in Africa, I don't know whether there is an official explanation regarding what their concerns are that you would like to share with us. Thank you.
So, Paul, I didn't get a second question, but let me try the first question. The internet keeps dropping a little bit, so but let me take on the first question. I've spent four and a half years on this position, and it's just very clear in my mind that the continent has a huge human capacity for public health, and including both at the leadership level and at a more operational level. What is the challenge on the continent is such a vast continent is how do you bring that expertise together? And that is where Africa CDC has been focusing. And we've created networks of national public health institutes, including the Nigeria CDC, where my friend Chikwe used to be the director and did an outstanding job. We network ourselves and meet regularly. We used to meet every year to bring together that expertise. If you look at across our response spectrum, when COVID just hit us, what we did, Paul, was to establish what we call the African Coronavirus Task Force. And the people within that task force were not just folks from Africa CDC. They included Amadou Sarr, from the director of the Pasteur Institute in Senegal, Professor Muyembe from DRC, Nathalie Meyer from the National Institute of Communicable Diseases in South Africa, Professor Marufi in North Africa. These are all very capable individuals in their own right but they haven't had the opportunity previously to come together and work together. So I think that is the beauty of what your Africa CDC and the African Union has done in this pandemic, bring people together. I'll take it even one step further. The ability to also bring in the diaspora. They found it very interesting because a lot of our own brothers and sisters who are out there are yearning to contribute. And because we created this platform, they could come on every Tuesday at 4 p.m. East African time and contribute. And they've contributed in developing guidelines documents, reviewing documents that goes to countries, and then actually implementing them at the country level. So I think the human resources for her is for at least in Africa is there. It's not enough, but it is there. We should always recognize that. The second part of your question, if you don't mind repeating that, I think the internet dropped a little bit and I couldn't follow that.
Yeah, thank you. So my question is this, with the UK and a few other countries in Europe not recognizing vaccines administered in Africa, is there an official explanation to why this is happening? So that's have they provided any explanation?
No, I think let me start with the European Union. The first time we discussed this issue when the European Union issued their travel restrictions to the vaccines that they will recognize or not, especially not including the COVID sheet. We had a face-to-face meeting with the ambassador to the EU from the European Union. And my understanding, and we subsequently issued a statement at that time, was that they wanted the Serum Institute in India to register the COVID vaccine within the European Medicine Agency. Okay, so we argued on the contrary, that because that vaccine has been endorsed by the WHO or given emergency authorization use, it should be sufficient to protect people. And you now know that about 19 countries or so in Europe do recognize anyone that has received the AstraZeneca vaccine, the COVID from India. And this is very important. What you are saying is extremely important because, as I indicated earlier, the government of India has announced that they will start re-exporting vaccines, and it will be the COVID vaccines, and most of our people will be vaccinated with that. So if we do not address that issue squarely, it will be problematic. We did issue a statement at that time calling for the EU to review the situation, and the African Union also issued a statement at a much higher level, at the level of the president of the European Union Commission, also addressing the same issue. Now we are also dealing with the UK situation, and we're always very surprised when these things happen. So again, it is the fight that we need to continue to engage with our colleagues in Europe and in North America as well, so that they understand how we feel when these positions are taken, which are not backed by science or evidence.
Thank you very much. We move on to Ayanat Mercy, who is with Reuters. And she says that the US announced on Wednesday that it would be donating 500 million more COVID vaccine doses to countries around the world. Do you have any information as to which countries might receive these doses? And also, are there any concerns that the fact that these are Pfizer doses will prejudice countries that need the doses but may not necessarily have the storage facilities?
Yeah, so thank you for that question. We were on that summit yesterday, that is the COVID summit that was hosted by President Biden, and we welcome the news of the announcement of the 500 million doses of vaccines from Pfizer. We also have been discussing with the Gavi in Geneva and how we, Africa CDC, can work with them so that we can expand the ultra cold chain requirements so that when these vaccines arrive the countries, they can actually be used so that we do not get ourselves restricted with respect to which vaccines are coming and only focus on vaccines that are easily deployable. So I think, first of all, let's celebrate the good news that 500 million doses of vaccines have been promised. And let's also hope that they will come soon on the continent. We didn't know, in making that announcement, President Biden didn't specify which countries will receive the vaccines, but we understand that these vaccines will be delivered through the COVAX mechanism. As we get more details, we will be happy to share. But you and I heard the announcement almost at the same time yesterday.
All right, thank you very much. Judith Akolo from the Kenya Broadcasting Corporation says, now that some countries like Britain have begun the booster vaccination of their populations, will this again affect access to vaccines by Africa?
Yes, Judith, it will. Each time there's excess use of vaccines, there's the likelihood that the continent will continue to not have enough vaccines. And our position is very clear with the booster that we have not seen enough evidence and data to justify that there should be a need for a booster. We just on the 15th of September, if I recall, the New England Journal, which is a very prestigious and highly respected journal, published a paper showing that the Pfizer and Moderna vaccines were still maintained their efficacy after 6 months. And that if you even look at the efficacy of that or effectiveness of those vaccines against preventing severe disease, it ranged from about 86% to 100%. So I think there's then a conclusion to be made that these vaccines are still efficacious at 6 months. Clearly, the immunity wanes, but it's not. It doesn't get you to a point where you are at severe risk of developing, at risk of developing severe disease. I think that is what that paper says. You can go read the paper, that scientific paper, just as I did. We have now seen the recommendations from the United States government saying that they're not recommending that the entire population should receive a booster, but that some targeted groups could receive it, like people above, I think it's 65 or 60 years, and those with severe immunosuppression, with that is compromised immunity, could receive the booster vaccines. So I think this is all an evolving area, but we believe that the bulk of the people who are otherwise healthy and have received the vaccines, we do not see any need for that. Based on the science and evidence. We will at Africa CDC in the coming days be issuing our own recommendations on how we see the third dose or the booster dose being used.
All right, thank you. Let's move to our WhatsApp group chat. And we have a question that's coming from Nicholas Barrio, who is with the Wall Street Journal in Uganda. Do you think that there are enough global COVID-19 vaccine supplies to allow developing countries to reach 40% vaccination by the end of 2021 and 70% by next September, while rich countries get booster shots at the same time?
I think that two things need to happen. We should actually make sure that we first of all redistribute those vaccines that countries that are holding them in excess. If they can release those vaccines, then there's a chance that we should be able to vaccinate and get to that target of at least 40% by the end of the year. But it's getting very tight. Okay, yeah, this is we are at the end of September, so you only have 3 more months to go. That is October, November, and December. So unless those vaccines are truly available now, it will become very difficult to get to a target of 40% immunization. It's still possible that if the right things are done, which is we redistribute the vaccines, place the developing countries ahead of the queue so that they can actually get the vaccines through COVAX, and thirdly, begin to free those export bans that have been placed on ingredients that are very important for vaccine manufacturing. If we do all three things, then there's a chance that we can achieve a 70% target by the end of next year. We, Africa CDC, had stated that early on, since last year, that a target of 60% was reasonable for the continent. At that time, our position was was not fully understood and supported. So now we are happy that the world has even taken that level higher to at least 70% of the entire population being vaccinated. We are pleased with that, but we now call for the international community to work with the countries so that they can meet those targets. Each time we set the target and not meet the target, we do not create trust with our own communities.
All right, thank you very much for that. Let's say hello to Coletta Wanjohi, and she's with Feature Story News. And Coletta says, how much has this pandemic diverted the continent away from other serious issues like HIV?
Coletta, that is a very pertinent question. The impact of COVID-19 on other diseases, i.e. Tuberculosis, HIV, and malaria has been severe. The Global Fund just issued a study or published a study a few weeks ago, clearly showing how the level of testing for HIV has decreased significantly over the last couple of months because of COVID. And for HIV, is a formula for treatment. If you do not test people, you can't put them on treatment. So my assertion, without data at this point, is that the damage will be more severe in the coming weeks and the coming months because of the impact of COVID. I know that countries are gathering data to substantiate fully this situation, but at least from where we are, we know that it's already creating a lot of harm on our existing programs. We're on the good trajectory to fighting HIV and bringing it under control, but I must assure you that the last close to 2 years have been extremely harmful to those very important programs.
All right, thank you. Judith Akolo has a second question, and she says, my other question is, with India resuming the exports of AstraZeneca, will this now aid Africa in accessing the optimum number of doses that is needed to realize the 70% vaccination coverage?
No, absolutely. If you, Judith, recall, with the AVAC process, that is the African Vaccine Acquisition Task Team, we have secured 400 million doses of vaccine, which will enable us to vaccinate up to 31% of our population. So if those vaccines from India are released, and they will definitely go through COVAX, then they will also now enable us to vaccinate up to about close to another 30% of our population. And in November of this year, we'll begin to get those doses from the MasterCard Foundation collaboration, 50 million doses there. So, and of course, the bilateral donations there. So if all of these things happen the way they have been pledged and promised, and if India follows through and release those vaccines through COVAX, then we should be in a good place going forward.
All right, so we have a question that's coming through our chat platform, and it's coming from Chinedu Asadu from the Associated Press. Chinedu says, my question is that in countries such as Uganda, vaccine uptake remains lower than what authorities had hoped for and what they had hoped it would be at this point in the pandemic. So he says Uganda now has more than 2 million vaccine doses in storage near the capital, but in rural areas, many are looking for jabs and they can't find them. This is partly because of the cold chain demands as well as the fears of wasting shots in remote areas. Is the Africa CDC director concerned about this? And is there a danger that vaccination efforts are stalling or losing momentum in some parts of Africa, even as substantial batches of doses start to arrive?
Yeah, I think contrary to what we have seen across Africa is an increased demand of vaccines. I think I was in Morocco 4 weeks ago, saw long lines of people, not just in one city, but in several cities. We have seen pictures from Zimbabwe, from Rwanda, from Senegal, The Minister of Health of Togo called me 3 days ago and said, John, I need vaccines. I'm vaccinating about 30,000 to 40,000 people a day, and the stock that I have is going to run out very soon. And I'm scrambling now I'm looking for vaccines across the world. And he actually said, I'm ready to pay the transportation costs from anywhere that you find the vaccines to be delivered in Togo. So that is a good example of countries that are really doing well. And I did share with you how some of the forerunners actually are doing in terms of scaling up vaccines. So, and of course, our continent is very heterogeneous, and what I just described, of course, doesn't apply across the entire continent. There are some countries that are still struggling with the vaccine or rollout and uptake. And we will be looking at those countries, including, of course, Uganda, and as to why their uptake has slowed. What can we do with the community and religious leaders to improve uptake of vaccines? And what is it that we can do actually to create champions and use sport celebrities and local musicians to promote that? There's a lot that we need to be thinking collectively on what to do with and to improve the ability to uptake vaccines in the countries.
All right, we move to Eswatini from Bonisile Makubu, and she says it has emerged that the Johnson & Johnson vaccine has to be boosted in about 2 months. What has the Africa CDC done to prepare to meet that requirement? And what is the position with the other 2 vaccines, i.e. AstraZeneca and Pfizer?
So that is I have not seen that study. And if I'll be happy to review that study carefully, because that is exactly the kind of data that we need. We need data by vaccines, because these vaccines are very different in terms of the immune response that they generate. So we would like to see data over time with respect to what is it exactly, at what time point does the immunity for AstraZeneca wins? At what time point does the immunity for the Johnson & Johnson wins? And what time point does the immunity for Moderna and Pfizer win? So we just don't have that data. So if you have some data from the Johnson & Johnson, I will be more than happy we will be more than happy to review it and then take decisions. But for now, I have not seen any of those studies.
All right, thank you. I think let me take this question from Ionet Ejide. And Ionet says, reports indicate that Germany will nominate Dr. Tedros for a new term at the WHO. And he asks, do you support his re-election bid?
So I don't know how the WHO nomination process goes. And I work for the African Union, so I think it would be better to wait for and see what the African Union position is. And that way, as a staff of the African Union, I would definitely go with what the African Union's position will be. So I cannot take an individual position because that is political.
All right, thank you. I'm just seeing some questions. One question coming in on WhatsApp, and it's from Esther Nakazi. And Esther is a freelance journalist. She says, what is happening with Burundi and Eritrea in terms of accessing vaccines?
So thank you. As I expressed earlier, Burundi has now contacted us, and they are working with the AVAT, the African Vaccine Acquisition Task Team, as well as COVAX to acquire vaccines. So I'm very encouraged with that. We still have some work to continue to do with Eritrea to bring them on board.
Okay, thank you very much. I don't see any new questions that are coming in. So perhaps this is the time for you to give us the summary of your main headline points for today.
No, thank you, Wayne, and colleagues who really come on this platform very consistently and regularly. We truly appreciate your commitment to sharing information and knowledge on this platform as much as possible. I think my only message this week is that of increased solidarity and cooperation, so that this kind of statements that that we see from the UK with respect to the travel restrictions cease from being issued, because they are confusing our people. They are creating more reluctance for people to receive vaccines, because the people are questioning that, well, if you make us take vaccines and European countries are refusing us to recognize those vaccines, what does that really mean? Do they know something about the vaccines that we don't know? So I think it's a call for action that we should really base our policies and decisions on science, and not just take a position that will harm our ability to administer vaccines on the continent.
Thank you very much. That was Dr. John Nkenga Song, the director of the Africa Centers for Disease Control and Prevention, speaking to you from the African Union headquarters in Addis Ababa in Ethiopia. So this is a time that I thank you very much, colleagues from the media and from the communications broader section, for all the work that you are doing, and hope that you will be able to join us again next week on Thursday at the same time. So for now, bye-bye.
Thank you, Wayne. Bye-bye.